Hello and welcome to the first in our series of bite-sized valuable educational videos about Hevylite. My name is Cornelius Willisey and I'm a medical science liaison here at Global Headquarters. Buying Insight are the pioneers of free light chain test. Today, many laboratories use free light together with Hevylite to optimize the management of monoclonal gammopathy testing. Hevylite are a set of 6 unique immunoassays exclusively available on the Optilite special protein system. Hevylite assays enable the separate measurement of the heavy plus light chain isotypes, for example, differentiating between IgG kappa and IgG lambda. Unlike routine total immunoglobulin measurements, which do not differentiate between the protein produced by the monoclonal and polyclonal plasma cells, Hevylite enables the monitoring of both the involved and uninvolved heavy and light chains, which can provide valuable information for the management of multiple myeloma. The involved heavy and light chain is the one produced by the tumour, while the uninvolved is produced by the non-tumour plasma cells. The best way to understand the benefits of Hevylite is if I show you an example of Hevylite utility in a simulated patient who has a tumour producing monoclonal IgA kappa as well as polyclonal plasma cells producing polyclonal IgA kappa and IgA lambda. A total IgA assay quantifies both IgA kappa and IgA lambda together, and in some myeloma patients, the serum concentration may fall within the normal range because a decrease in the uninvolved heavy and light chain masks the rise in the involved. In this example, we see this patient has a total IgA of 3 grams per litre, falling within the normal range. However, in this particular example, if we measure the isotypes with Hevylite, we observe that the IgA kappa concentration is elevated at 2.75 grams per litre. The IgA lambda is suppressed at 0.25 grams per litre, and the heavy light chain ratio, which is the IgA kappa divided by the IgA lambda, is increased and abnormal. This indicates a monoclonal IgA kappa with HLC pair suppression. Therefore, Hevylite can aid in the monitoring of monoclonal gammopathies and in identifying plasma cell clonality through calculation of the heavy light chain ratio. In addition, Hevylite can aid in the determination of immunosuppression with the additional strength of measuring isotype-matched immunopoiesis. Hevylite also provides a range of benefits for laboratories to address issues seen with common electrophoretic techniques, such as co-migration of monoclonal proteins with other proteins in the sample, multiple peaks in the electrophoresis gel, disaturation of the gel, broad migration of the protein in the gel leading to broad, difficult to measure bands, and precipitation of proteins when they are applied to the gel. All of these issues make it difficult to measure the monoclonal proteins precisely. In a later video in this series, we will discuss this in more detail. The International Myeloma Working Group has recognised the limitation of electrophoretic methods, such as serum protein electrophoresis, in assessing certain multiple myeloma patients with IgA myeloma, and recommend measurement using nephelometric total IgA quantitation. However, this method also has a limitation and does not account for polyclonal IgA background. Thank you for watching this video. We look forward to welcoming you to the upcoming videos in the series, which will cover Hevylite clinical utility, laboratory challenges in measuring IgA, and more in-depth knowledge surrounding immunopoiesis. Please feel free to reach out for more information on how Hevylite can assist you today in your laboratories.